Hello everyone, this is Dr. Aman from Edupedia Overseas. Today I'm sitting in Kharkiv and I have the pleasure to be talking to one of our students who just graduated. Could you please introduce yourself?
Hello everyone, I'm Dr. Shailza, just graduated last month from Kharkiv National Medical University.
Where are you originally from?
I'm from Punjab, Ludhiana.
Okay, all right. So you had a full journey now of 6 years. It came to an end. How does it feel?
So being a doctor, this feeling is good, but leaving Kharkiv is something that gives a little bit of pain.
Yes.
It's a beautiful place.
Have you grown roots here?
Some, kind of.
Yes.
It's a place you get attached to very soon. The weather is good, people are good, surroundings are good. So yeah, you get attached.
Yes, that's true. I still remember my time leaving here after graduating. It was tough, like, to be honest. And maybe you remember the time when you first came here. How did you feel? How were your first days, weeks and months?
The day I came, it was 22nd of October 2015, I remember.
Wow, very well.
Yeah, so when I came, we went to the hostel. It was the first time without my parents. So it was a tough time. But yeah, I got like comfortable soon. It is not like no homesickness or something. Just for a few months it was, but then I got comforted.
And what helped you to get comfortable?
So we came through Dr. Karan, Edupedia. So if we have any problems, they are there to solve. So there is no problem that we face if we have them at our back. So there was no like fear or anything.
All right.
So that's why.
And did you make friends very quickly?
Yeah.
Okay. Where did you find those friends?
Friends I made were due to the seminar in Amritsar. So that was our batch, and we are still together.
Oh wow, that's so good. 6 years long journey. Is it true that one of the main fears in the beginning is that maybe you will be alone or you won't find any friend circle?
Yeah, kind of. Everyone feels that, but you soon realize, you grow up, you meet people, you make friends.
All right. Did coming to Ukraine change you as a person?
Yes, a lot.
How did you change?
Before coming here, I was very, I would say, timid and shy. I would not open up to people, but now, you see, I can talk. Yes,
yes, and you can talk, and very well as well. Okay, so what can you suggest to the students who are in India, and maybe you remember your time when you were still in India and maybe you only wanted to study in India at that time?
Okay, so coming to Ukraine, people may say that you should study in India, not in Ukraine, because of, I don't know, they have some doubts about the education level, but I feel the European system is good. The teachers are good, and it's a good way to brighten up your future. You grow up, you do not become a doctor, you grow up as an individual. I feel.
I think that's also really important, because you can't be a doctor and be a child at the same time, so you need to develop in both directions at the same time. You said that you like the European study system. Can you tell me, or can you tell the viewers, what exactly did you like about it?
What I like is we have tests every day. So it's not like you study for 1 month, teacher teaches you and then you don't study. It gets out of your mind, and then before exam you just cram everything. So we study every day, we have tests every day. So it's easier to study every day than just one day before exam.
I agree. What about practicals? Have you seen patients here? Have you taken case histories? How can you take the case histories? How can you do practicals if you don't speak the language?
They teach us language for 3 years, so the basics are clear. We know enough to communicate, I guess, if we study. So for 3 years we have paraclinical subjects, but after 3 years we have clinicals. We go to specific departments like cardiology, neurology. Teacher shows us patients. We take the case histories.
Yeah.
So good.
All right. Did you already have practical classes in your second year? Maybe you remember pediatrics, internal medicine, and surgery. No?
We have practicals from 4th year.
From 4th year. So in the second year you didn't have classes where you learned how to take blood pressure, how to take the temperature?
We had only paraclinical subjects.
All right, okay. So what was your favorite subject throughout your studies?
It was internal medicine, particularly neurology.
All right. So are you going to specialize in this field?
I want to.
All right. Okay. Last question for you. What are your future plans?
I want to clear my MCR first of all. Then I want to go for PG. I'll try to get it in neurology.
All right. Okay, doctor, I wish you all the best and in passing your exam in December, I guess.
Yes.
Yeah. And hopefully we'll talk to you another time when you tell us what you have done so far.
Thank you so much.
All right. Thank you very much for the interview. If you like this video, please don't forget to give a thumbs up and subscribe to our channel so you stay updated with everything which is happening around the world and medical students. Bye.